Hey there, my name is Dr. Kalathur. I'm a board certified telemedicine physician practicing in the US. Today, we're going to talk about the flu or influenza. Influenza infection or flu is a virus infection which peaks in winter months. Common symptoms are sore throat, nasal congestion, body ache, chills, fatigue, and sometimes even shortness of breath. Yes, it can be. Most people get better on their own without any lasting problems, but some need to go to the hospital because of the flu. Some people even die from it. This is because the flu can cause a serious lung infection called pneumonia. That is why it is important to prevent flu. People 65 years or older, young children under 5 years of age, especially under 2 years of age, pregnant women, and people with certain medical conditions like smoker's lung, congestive heart failure, cancer patients, or patients who are taking some medications which can affect their immunity, like biologics. If you or your child is in one of these categories, talk to a doctor or nurse practitioner. They can help you decide if you or your child needs treatment. In some cases, family members of a person with the flu might also need medicine to help prevent them from getting flu. Of course, wash your hands with soap and water. Flu is mainly spread through air, so stay away from people who are sick. You might also choose to avoid crowded places and or wear a mask. Get the flu vaccine every year, which is a big one. Ideal time to get the vaccine is late September or early October. This is to get the vaccine before the flu peaks. In some years, the flu vaccine is more effective than the others, but even in years when it is less effective, it still helps prevent some cases of the flu. It can also help keep you from getting severely ill if you do get the flu. Stay home, rest, drink plenty of fluids. You can also take Tylenol or acetaminophen. This is to relieve fever or body aches. For a typical normal adult, the dose can be 500 milligrams 3 to 5 times a day. Do not give aspirin or medicines that contain aspirin to children younger than 18 if they catch flu. In children, the aspirin can cause a serious problem called Rey syndrome. Most people with flu, they get better on their own within 1 or 2 weeks. If you have trouble breathing or shortness of breath, you have chest pain, you're suddenly getting dizzy, if you're getting confused, you're having severe vomiting where you can't keep anything down, etc. Take your child to a doctor having if they start breathing fast or having trouble breathing, turning purple or blue, or not drinking enough fluids, will not wake up or will not interact with you. The child is very irritable and do not want to be held. This is another scenario where the symptoms of the child get better from the flu, and then all of a sudden the child starts getting sick again. This might be a sign of pneumonia. And if the child develops significant fever or any rash, the child has to be taken to a doctor right away. If you go to a walk-in clinic or a hospital because of the flu, tell someone right away why you're there. The staff might ask you to wear a mask or ask you to wait at a specific location to prevent the spread of the infection. Whether or not you see a doctor or a nurse for flu, stay home while you're sick with the flu, or keep your child home if they are sick. Do not go to work or school until your fever has been gone for at least 24 hours without taking a medicine such as Tylenol. If you work with patients, such as in a hospital or clinic, you might need to stay home longer if you're still coughing. Also, always cover your mouth and nose with your inside of your elbow when you cough or sneeze. Yes, people with the flu can get medicines called antiviral medicines. The most commonly prescribed antiviral medicine for flu is called Tamiflu or Oseltamivir. These medicines can help certain people avoid some of the problems caused by the flu. Your doctor or nurse practitioner will decide if you need an antiviral medicine. Antibiotics do not work on the flu because flu is a viral infection and not a bacterial infection. The flu can be very dangerous during pregnancy. If you're pregnant, it is very important you get the flu vaccine. You should also get the vaccine if you're planning pregnancy. You should also avoid taking care of anyone who has the flu while you're pregnant. If you're pregnant, call your doctor or nurse right away if you think you might have been exposed to someone with the flu, because the doctor might decide to give you the antiviral medicine to prevent flu. You should also call the doctor or nurse practitioner if you think you might be getting sick with the flu. In pregnant people, the symptoms of the flu can get worse very quickly. The flu can even cause trouble breathing or lead to the death of the pregnant mother or the baby. That is why it is so important you talk to your doctor or nurse practitioner as soon as you notice any of the flu symptoms I mentioned. You will need an antiviral medicine if you're pregnant and have the flu. I hope I was able to give you some idea about what influenza is, what to do to prevent it, and what to do if you catch it. I hope you don't catch it. So please follow my channel or subscribe to my channel for future videos. Until then, goodbye and take care.